Hi, I'm Tyler with Invigor Medical. Today we are going to discuss the proper technique for reconstituting lyophilized medication. Your medication comes in a powdered form. A liquid diluent, usually bacteriostatic water, must be added to dissolve the powdered medication so it can be injected. In this video, you will learn how to prepare your medication for injection. Step 1. Gather your supplies. In a clean, well-lit room, collect all the necessary items, including the medication vial, the diluent, the syringe and needle, 2 alcohol prep pads, and the package insert with the dosage information. Step 2. Draw up the diluent. Look at your medication instructions to see how much diluent should be added to your medication. Wash your hands with soap and water. Peel the cap off the top of your medication vial and diluent vial. Open your alcohol prep pad and clean the rubber membrane of the diluent vial thoroughly. Let dry. This will kill bacteria on the vial and reduce the risk of contaminating your medication. Open a fresh syringe and needle. Screw the needle onto the syringe without removing the needle cap if it's not pre-assembled. Pull the plunger on the syringe up and down several times to loosen it before uncapping the needle. Look at the syringe barrel and note the unit numbers along the shaft of the syringe. Identify the line indicating how much diluent you should add to your medication. Uncap the needle while being very careful not to allow the needle to touch your hand, table, or other surfaces. Hold the syringe upright with the needle facing up. Pull back the plunger to fill the syringe with air just past the prescribed dose. Now holding the syringe so the needle is facing straight down, insert the needle through the center of the rubber membrane. Flip the syringe and diluent and inject the air into the vial. Make sure the tip of the needle is in the diluent and that the syringe is rotated so you can see the dosage lines on the syringe. Withdraw the correct amount of diluent into the syringe just past your prescribed dose. Push the plunger so that the top of the plunger is level with your dose, expelling any air bubbles. Then, pull the syringe from the vial and replace the cap on the syringe, taking care not to bend the needle or touch any surfaces outside of the needle cap. Step 3. Add diluent to medication. Using the second alcohol prep pad, clean the rubber membrane of the medication vial thoroughly and let dry. Now holding the syringe so the needle is facing straight down, insert the needle through the center of the rubber membrane. Flip the syringe and inject the diluent into the medication vial. Pull the needle from the medication vial. Gently mix the medication vial by rolling it between your palms until all of the medication is dissolved in the diluent. Check to ensure there are no clumps or visible undissolved medication. Store your medication as instructed until you are ready to inject.